Hey, Dr. Powers, it's Mary calling from Mystic U. I was calling about one of your patients in room 21, Mr. Powers. Do you know him?
No, I don't. Tell me a little bit about him.
Oh, okay. He's a patient that came in yesterday of one of your associates with chest pain, and today he's having unrelieved chest pain for an hour after giving him a Tylenol.
Oh, okay. Well, what kind of pain is he in, and has he had this kind of pain before?
Yeah.
And has he been in the hospital before?
Oh, yeah. I'm sorry. I forgot to tell you that, he had a cardiac cath yesterday, and they didn't find too much, but he's had this pain before. He said he's had it at home, and it's nothing new for him.
Well, that's pretty important information you left out there, nurse. If you could go ahead and schedule him an EKG and start him on morphine right away, I'll try to get up there and see him as quick as possible.
All right, thanks. Click. The role of the nurse in this scenario, she left out an important information. If she had used her SBAR form like one of these, and I don't know if you see it, but there's SBAR. If she had used the SBAR form to be more organized and concise and get all her information together before calling the doctor, she could have prevented the miscommunication with him of not knowing what the patient was in here for, or if what kind of tests he'd already had done, and the care could have been delivered to the patient faster. Also, standardizing communications help reduce risk during transitions and handoffs, reduce reliance on memory, assurance that critical information is shared, um, and help team members speak up when they see safety hazards. Also, the physician in this scenario told her just to go ahead and order morphine, but didn't give a dose, route, time, or frequency of how often he wanted the patient to have it. They also didn't review allergies together. The doctor should have done a better job at giving her the correct orders so that she could give him his medicine in a timely manner. This is just going to cause problems. Pharmacy's not going to be able to put it in, or she's not going to know how to put it in, and we don't know how long it's going to take for him to get to the floor to come up and physically see the patient. And meanwhile, the patient's still having terrible chest pain. So, you want to manage his pain more effectively by going ahead and getting the correct orders the first time from the physician, and getting his pain managed so things can go ahead and get rolling. As a new nurse, she probably could have consulted with a more experienced person and collaborate in a collaborative effort to figure out what's wrong with the patient. And a more experienced nurse would have gone ahead and told her to get an EKG before calling the doctor, and gotten all her stuff together before calling the physician. In healthcare, though, distractions, lack of attention, forgetfulness, people, a task at hand, skill level, and the environment are all reasons why we make mistakes and leave out information. Again, the use of the SBAR tool to standardize communication is so important, and the essential information being passed on. Most adverse drug events occur at handoff points from one provider to another, and the doctor should have clearly stated what he wanted in order to not delay patient care or safety.